Okay, so again, what happens now is that you've got this food antigen that has a bunch of junk on it, and you've got these things called tight junctions. And this is supposed to keep the bad stuff inside the GI tract and keep us safe from all of this. And this starts leaking. This is what we call leaky gut syndrome. Okay, and the leaky stuff ends up out here and it starts activating the immune system. Okay, because this is undigested, it's not working well, and it has a bunch of stuff on it that's not supposed to be there, which activates the immune system to trigger off. Okay, I'm going to just briefly go through this because I'm going to run out of time. But this was a study that was done in 2014, and they took mice, with healthy bacteria, and they fed it regular water, glucose, and sucrose. And they had balanced, good gut flora, good bacteria inside their gut. They were able to tolerate glucose, and they developed no diabetes and no weight problems when they had this. Okay? Now, when you go in and you start feeding the mice these artificial sweeteners, it damages the gastrointestinal tract and the healthy bacteria, and you start creating imbalance or intolerance to glucose. This is not glucose. These are artificial sweeteners. Some of them have chlorine in them. They have toxic chemicals in them. And so when you start using the little pink sweeteners and things like that, this is destroying your gut and it's causing diabetes. And so this causes imbalance in the artificial sweetener, and then when you eat glucose, it reacts to it like it's an immune reaction. You can feed somebody a pure glucose and a high-fat diet with a balanced gut, and they still have tolerance. And then you take the high fat and the commercial saccharin and they cause imbalance. It destroys the gut. And so they have glucose intolerance and they become a diabetic mouse at that point. So then they transferred the bacteria from one mice to the other, and after 60 days, this mouse still had healthy bacteria and it was able to tolerate basically foods. You did the same thing with saccharin, and they transferred into a germ-free mouse with the bad bacteria, and it developed intolerance within 60 days. So these artificial sweeteners are destroying our gut lining, and they're in everything. Oh, you're a diabetic, or you shouldn't be eating sugar or whatever, and so we go to the artificial sweeteners, the Diet Cokes and all this junk. And then they took, so this is NAC, is the non-caloric artificial sweeteners, and it induces gut dysbiosis, which is destroying the healthy bacteria. It increases weight, it causes high fasting glucose, it causes hemoglobin A1C to be elevated, it causes liver enzymes to be elevated, and it can't distinguish between healthy bacteria and non. And so this is significant. When you're using artificial sweeteners and artificial chemicals, the body starts destroying itself, which causes an immune dysregulation. Then we're back to this again, and the immune system goes haywire when you don't have any gut flora. Okay, so how do we go from having an immune response inside the gut to the food that you're eating to attacking the tissues? I bet you're all thinking that, right? So all food that we have amino acid chains. And this is shrimp, and I put this in here because I wanted you to see. This is the peptide chain or amino acid chain. And what happens is when you mount that immune response to something, when you haven't eaten it or when you're out there doing, then what happens is the immune system remembers that. If anybody's in here that's had medical training, it used to be the lock and key system. When you give someone a vaccine or you introduce bacteria or something, the immune system will remember. It's like a key. And it remembers, it fits into the lock perfectly. They used to call it the lock and key mechanism. And so this mechanism, you can see the chain looks similar to a human tissue. And then when the immune system is looking around and it's buzzing around your body, it looks for this tissue or anything similar to it, and it starts attacking it. This is how we get autoimmune disease. These guys, these lectins, are anti-nutrients and they're found in plants. And lectins cause an immune reaction. And so people that already have autoimmune reaction really need to stay away from lectins. Lectins, people say, why do I, when you put me in an autoimmune diet, why can't I have beans and grain? Because they're very high in lectin. And they cause the immune system to overreact. So these are where lectins are found, and you can see grains are extremely high. So when you're on an autoimmune diet, they're going to take you off of grains and legumes because they're very high in lectins. And lectins cause the immune system to overreact. There are no low lectin legumes, unfortunately. So lectin is mainly in the gut, but it also can start creating infertility issues and immune issues. Here it says lectin, and this is a research study in an allergy journal. It develops diabetes, RA, and again, once you start developing an autoimmune disease, it will start moving from one system to the next. Food coloring. This is a carcinogen. We're feeding it, dumping it in the truckloads into our children. I used to take care of my niece when she was a little toddler. She's 16 and she's 6'2". She is a size 13 now, feet. But she was a little kid, and you know, she was like 7 months old. She comes to my house, and I go to change her diaper, and she had pooped, and her poop was green. I mean green, like bright yellow green. And I called her mom and I said, what did Kyla have to eat? She says, oh, well, Grandma took her over to McDonald's and they had a shamrock ice cream thing. So she ate this like malt that had green dye in it, and the next day her poop was the same color as the shake. She could not process that. Her body was getting rid of it, and how much of it stayed in her system. It's a carcinogen. Food colorings, I'm going to show you how they work and how they're so destructive to the system. Food colorings are being fed to our kids like unreal. They're in everything. They make things look so appealing to kids. So artificial food colorings bind to the protein in food, which cause a problem, which cause an immune reaction. And here's how it works. You can see, here we are, these all have food colorings, lipsticks and suckers and all of this stuff. It's unreal. So here's a protein chain of albumin, and our body digests this. And here, these little things down here where the scissors are, those are food colorings, and they attach on to the amino acids. Lysine, arginine, and histidine are the ones that they're attracted to. And this is where they're supposed to be cut right in here to break down to go across the gut. And these things go in here and attach on there and prevent it from breaking apart to be digested. So these are going in whole with the food coloring on, which is causing the immune system to overreact. So food colorings are extremely difficult for the system. And so when you're buying popsicles and candies and jelly beans and all these things that have these food colorings in, your kid is not digesting them. Your system is not digesting the foods that they're eating with them in there. It takes about 8 hours to digest a protein that has food coloring in it. 8 hours, which is unheard of. It increases. You can see here's a normal time. Here's the enzymatic activity, and so it takes a long time. So this is a favorite thing of kids, and you could see the chicken nugget has gum, food coloring, transgluminate. I showed this to my kids because they don't eat McDonald's. And my kid's like, well, what is that? I said, that's a chicken nugget. Transgluminase is a glue that holds it together. Glue. And it's in a lot of things. Meat is held together by transgluminate, and it's tested on my allergy testing. It's in almost everything right now. And I said to my daughter, I said, well, you know, my kids, they sit there and pick off the cartilage and the fat and the skin and all that stuff, you know. And I said, well, look at what's in the chicken nugget. There's skin and fat and bones and connective tissue. I said, you won't eat that when I feed you chicken. I said, why would you eat it in a nugget form? Gluten is a big one that we're going to talk about tonight. It causes a lot of problems. It damages the villi. This is your GI tract. Again, these are the things that we call that are villi. When you eat it and you have an immune reaction against it, it causes this problem, which decreases your ability to absorb nutrients, and you die 7 to 8 years sooner from malnutrition. Here's what wheat causes, and I'm going to tell you, this is just an abbreviation. My son was 4 years and 2 months old when I got him, and he has gluten issues. And I'm going to tell you how he reacts, because I've got a slide here. Gluten is a neurotoxin. It attacks the synaptic connection between nerves, and it causes ADHD, and it causes a lot of problems in the immune system. But these are just some of the things that you can see that it causes. Here's gliadin, which is a form of gluten, or a part of the wheat molecule. And this is what the peptide chain looks like. This is the synaptus of the nervous system, which is this down here. This is in the brain, this is in your nervous tissue, so on and so forth. When you eat gluten, you're attacking the synaptus between your nervous system. And it's destroying this function right in here. When you're eating gluten and you're having an immune reaction. This is an autoimmune disease against the nervous system. Is it MS? Is it Alzheimer's? Is it ADHD? Is it autism? It could be any of those, depending on what your age is and what part of it is, what part of the brain it's attacking. So this is a big deal. My son, when he would get gluten, his speech would go down like he was drunk. Like he had had a quart of vodka, and he'd come home from school, and I'd be like, I could hardly understand him. His reading would go down 2 grade levels because his brain was not working, because it was destroying and inflaming the gap junction between how the nerves work. This is the end of the nerve, this is the receptor site on the other side. And this thing right here is what the gluten attacks and destroys. This is milk. Milk has a very similar process. It is a neurotoxin as well, particularly to the brain. But you can see celiac, Crohn's, MS, RA, a lot of the same similar type things that if you have any of these disorders, you better get off of milk and milk products. Here are the human tissues. Here's milk, and here's the human tissue, and you can see how closely related they look. And when your immune system starts attacking milk, and it doesn't like milk because there's estrogen in it and there's toxins in dairy. Dairy is extremely toxic. It's lipophilic, it attracts. The cows are out grazing, even organic. They did a test on organic ice cream, and it has so much dioxin in it, which is from jet fuel. Dioxin comes and falls down, and the cows are out grazing, and they're eating it, and then we're thinking, I'm going to eat some organic ice cream, right? The fat from the milk and the milk product ends up in the ice cream, and then that fat attracts the toxins to it. It's called lipophilic. And so milk is extremely, you can see how closely related to many of the tissues they are. This BNNT 150, 51, and 101 are human tissues. This lecture slide comes from a guy that is an immunologist. I went to a lecture of his, and I asked him if I could use the slides. He said, yeah. So this is what he has studied to determine why it is that when you have an autoimmune disease, why the tissues continue to be destroyed. Pectin can be something, we find that in autoimmune joint disease. These are some of the things that we test as we move forward. If you have a diagnosis of any kind of the joint diseases or joint disorders, these are things that we look at to make sure that you don't have a cross reaction, because these things look very similar to the joint. RA and scleroderma. You can see these things look very close to the joints and the tissues that they go after, and so we test these to make sure that we're not having any cross-reaction. Systemic lupus, soy, carrots, corn, spinach are very closely related to the skin in that area, and so we look at those things. MS, you can see people that have neurological or neuroimmune disorders. As I said earlier, milk, milk products, corn, tomatoes, spinach, soybeans, plant viruses, and wheat. So if you have a neurological condition, these are the things that we start looking at. Again, these are tissues. We see this in legumes, and this is why legumes become a problem in autoimmune disorder. This is neuromyelitis optica, which is the nervous tissue in the eye, and corn and tomatoes and soy and spinach tend to be those things. When you eat those things, they look very similar to the nervous tissue, which then causes the immune system to attack the neurology in the brain and the eye. Okay, so now we're going to talk about organic versus conventional food and autoimmune disease and why it's important. There's a study done back in, I'm not sure what year this was. It was published in 2006, but I don't know what year the study was, where they did a dietary measurement of pesticides, basically, in 23 elementary school age kids. They substitute most of the children with conventional diets with organic foods for 5 consecutive days, and took 2 spot samples, one in the morning and one at night before they went to bed, throughout 15 days of the study period. We found that the median urinary concentration specific metabolism for these pesticides decreased to a non-detectable level within 5 days. Organic versus non-organic, within 5 days, their urine went and was clean within 5 days. That doesn't mean they still don't have it in the tissue. It just means that we can rapidly get rid of this, and the exposure is quite high in young children. In conclusion, we were able to demonstrate the organic diet provides dramatic and immediate protection against exposure to the pesticides and are commonly used in farming production. Okay, so this is why I said my average age of autoimmune is getting younger and younger and younger, because when I was an infant in 1960, my parents were organic farmers, and we ate very, very clean. But as we started introducing in the 70s and 80s, we started introducing all these pesticides. The kids today now are being exposed to higher levels of toxins, higher levels of pesticides in their food, food coloring, preservatives, and all of these things that are dysregulating their immune function. And if you think our health care is a big problem right now, we're moving into an epidemic because our kids are getting sicker and sicker, younger and younger. So the purpose of understanding the spectrum is so that we can consciously shift our thinking from the disease model, wait until you get it and then throw you on a steroid, to understanding how we return our health and understanding how we remove the trigger for the immune system. We want to understand how your health is deteriorating to measure the antibodies and measure what we need to be doing to understand where you're at. And so any slight elevation in antibodies in your body, let's just take the thyroid because it's the easiest to talk about. There are 2 tests that we do pretty routinely. It's a TPO and thyroid antibody. If you have any, 1, 2, 3 in your blood, it means that your immune system is attacking your thyroid. You shouldn't have any antibodies against your thyroid, none, 0. And so when you have any antibodies against the tissue, whether they're low or not, it's going to be a gradation of where your symptoms are. And so any antibodies in your system are a bad sign that you're shifting over into that spectrum of developing the disease. So it's important to understand that you have to get to the underlying causative factor of this. If you have elevated antibodies, they are fueling tissue degeneration and inflammation, okay? If you are being exposed to environmental triggers such as gluten, peanuts, toxins, mold, your immune system is activated to protect us from those things. They are not safe for our system. Pesticides are not meant to be in our system. There isn't anybody that can stand in this position and say that it is okay to be eating a conventional diet. You get 2.5 pounds of pesticides and herbicides in a conventionally grown diet per year. 2.5 pounds of cancer-causing chemicals in your diet. It's not okay. The immune system doesn't like it. It's creating cancer. It's causing autoimmune disease. End of sentence. There is no discussion. Now, is organic better than non-organic? It is, because it has less of it in it. It's not perfect. I'm not sitting here saying I don't have any exposure. That's not true. I do. But I have filtered water. I eat as cleanly as I can. I eat fruits and vegetables, a lot of them. I take a lot of supplements every day because this is happening 24 hours a day. This immune reaction, when you're getting pesticides and things in your system, the immune system never ever shuts down. Every meal you eat, you're activating your immune system. Every time you go to Cub Food or one of these places that have conventionally grown, mainly high processed food, packaged food, you are activating your immune function. End of sentence. And when you do that, you are going to start creating dysfunction in the gut. And the amount of insult depends about the amount of your exposure. Okay? The younger you get it, now we go back to that slide in the beginning where the umbilical cords were full of 287 chemicals out of 413. So they're getting it right from conception. And so we're in a big trouble here. The exposure continues to increase. The immune system has to respond more and more aggressively. You're not getting the message. Our immune system's working, we don't know. You know, sometimes you say, I feel like I'm getting sick, I feel a little achy, you can't feel. That's how you feel every day. Listen, when you get up and your joints are stiff and your muscles hurt, you feel cruddy, you get brain fog, you're an autoimmune. You shouldn't have body pain. I don't care how old you are. Body pain is not normal, it's inflammation. And it's an inflammatory reaction. The excessive inflammation causes cellular damage. This cellular damage continues to cause the organ to be dysfunction. Is it nervous tissue? Is it the thyroid? Is it platelets? Is it whatever disease? Brain tissue? You know, it will continue to damage the organ until you create symptoms, like in MS. It takes a long time to demyelinate all these nerves. And eventually you start getting this weird kind of vision stuff going on. You think, I don't know what that is. Or you'll start getting some tripping a little bit, and you start getting some symptoms down into your legs that you kind of blow it off. It's hard to diagnose. That's happening for a long time. The immune system has been working a long time. The inflammation continues, and eventually the symptoms are going to intensify. If you have symptoms and you have been diagnosed, you are in organ damage. You continue to elevate the antibodies, and the organ leads to tissue damage and organ damage, and the organ is going to die. The thyroid will die eventually. That's what the medical practitioners wait for, is they wait for the thyroid to die, and then they put you on thyroid medication. So, depends on how long you've had the autoimmune spectrum, will depend on how much damage you have. Like I said, it can take up to 10 years or so before you can. The gift of having symptoms is that it will force you to notice that something's going on. Pain, body inflammation. We are not trained medically to start paying attention to these signs and symptoms. There's a lot of clinical signs and symptoms that we have that are abnormal, that medical doctors should be looking at and medical practitioners should be looking at, that are warning signs that we kind of ignore until they can give you a drug. And so we're back to this. We're back to this whole thing. We wait until this whole thing blows up. When your immune system is overreacting to peanuts, let's say you're feeding your kid peanut butter sandwiches every single day, And the kid's got eczema all over his body. Now the parents will bring him in and they, say, oh, what's wrong? Stop feeding him peanuts. And likely the immune system will calm down and whatever. When you get older and this continues to happen, it's harder and harder to reverse the process because the immune system has already gotten so ticked off. The organ has been damaged. The tissue has been damaged. What are some of the signs and symptoms of autoimmune disease? Fatigue. Well, who doesn't have fatigue? Right? Pain. Pain's not normal. Pain's a sign that there's something wrong. Depression, obesity, these are all signs that there's something going on. There's inflammation going on. All of these things tend to have. When you get a lot of fatigue and you're dragging your butt through the day and it's not an iron deficient anemia or a thyroid problem, you got something going on. If you've had your thyroid checked or you've got that regulated and you're not anemic and you still have fatigue, you're in autoimmune spectrum. Bloating and diarrhea. Those things are not normal. They're a sign that your GI tract is malfunctioning. Bloating and diarrhea is not normal. I had a nurse practitioner come in yesterday and I did a bunch of testing on her and she had bloating and diarrhea and fatigue. And she said to me, I didn't realize that I could go to bed at night and have a flat stomach and still have energy. She said it's been this way for 15 years. And that's because we fixed her gut. We're fixing her gut. Is she going to develop an autoimmune disease? You better believe it. These things lead to immune dysfunction. A lack of energy, which is fatigue, memory lapse. Memory lapse is not normal. When we have memory lapse and memory issues, there's inflammation on the brain. To be clear, symptoms of autoimmune are not the first manifestation of the problem. They are the last straw. MS, where you've got, leg dysfunction or blindness, that you're at end stages at that point. This is the beginning. Conventional medicine. What is the treatment conventionally? If there's anybody in here that's been treating conventionally for autoimmune, there is no successful management of autoimmune. It's a progressive disorder. You will continue to dysregulate your immune system. The medications they're using are not helping calm your immune system down. They're just controlling the symptom. They use immunosuppressants like prednisone. They're anti-inflammatories. They suppress immune function, which then leads to cancer. I'm going to show you a slide here. Many people or many MDs, when they're dealing with thyroid, a lot of people have Hashimoto's, which is an autoimmune disorder. They wait for it to burn out and then they medicate you. They don't go, oh, you've got an immune problem. No, they say, well, you have Hashimoto's, you have a thyroid problem. Hashimoto's is not a thyroid problem. It is an immune problem. It's killing the thyroid. It's shooting up, it's destroying, it's tearing down the thyroid. It's not a thyroid problem. The thyroid is being destroyed by the immune system. Okay? They lose function, it causes extensive death, and then you have to be prescribed meds. The conventional medicine, there's no consensus of what causes autoimmune disease. That's because they don't study functional medicine. And so the treatment for conventional medicine varies and it's ineffective, basically. So we have to understand the underlying cause and effect of why you have the problem. Some people have jobs where they're exposed to toxins all the time. Some of us have high levels of stress all the time. I have 2 kids and my stress is really high. Some of us are not eating well and have eating issues and gut issues. There's lots of different reasons why we have these. The conventional treatment is with drugs. They're toxic medications. A lot of them are chemotherapy drugs. Methotrexate is one of them that they use. I had somebody use methotrexate, which is a chemo drug, on an 11-year-old kid for autoimmune disorder. I about flipped away. Like, you have got to be kidding me. This kid also had celiac disease, which is an autoimmune disorder, and they used methotrexate on an 11-year-old. This is a cancer chemo agent. Okay? This does not solve the problem. This causes more organ damage and liver problems. Okay? These drugs primarily block inflammation and they suppress the immune system. Well, guess what happens when you suppress the immune function? You're going to get sick. What happens when patients are in chemotherapy? They're wearing masks around and they have to stay at home because their immune systems are suppressed. So what happens when you're on autoimmune and your low-grade methotrexate treatment? Your immune system is getting weaker and weaker. It's not solving it.